Blood pressure. This is the force exerted by circulating blood against the walls of your arteries. We measure it in millimeters of mercury, mmHg, using a sphygmomanometer, blood pressure cuff, and stethoscope. There are two readings: systolic, pressure during a heartbeat, peak pressure; diastolic, pressure between heartbeats, resting pressure. Components of a blood pressure cuff and stethoscope. Blood pressure cuff, sphygmomanometer. 1. Cuff, a wide band that wraps around the upper arm and inflates to constrict the blood vessels. 2. Bladder, the inflatable part inside the cuff. 3. Bulb, a rubber pump used to inflate the bladder. 4. Valve, a small control on the bulb to release air from the bladder. 5. Gauge, a dial or digital display that shows the pressure in millimeters of mercury, mmHg. Stethoscope. 1. Earpieces, parts that fit into the ears to hear sounds. 2. Tubing, flexible tube that transmits sound from the chest piece to the earpieces. 3. Chest piece, the part of the stethoscope placed against the patient's skin. It usually has a diaphragm, flat side, and a bell, concave side. Proper technique for measuring blood pressure. 1. Preparation. Ensure the patient is seated comfortably with their arms supported at heart level. They should rest for at least 5 minutes before the measurement. The cuff should be the correct size for the patient's arm. 2. Applying the cuff. Wrap the cuff snugly around the upper arm with the lower edge about 1 inch above the elbow. Place the bladder's center over the brachial artery inside of the elbow. 3. Positioning the stethoscope. Place the stethoscope's diaphragm or bell over the brachial artery just below the cuff. 4. Inflating the cuff. Close the valve on the bulb and inflate the cuff by squeezing the bulb until the gauge reads about 20 to 30 mmHg above the expected systolic pressure. 5. Measuring the blood pressure. Slowly open the valve to deflate the cuff at a rate of 2 to 3 mmHg per second. Listen for the first appearance of the tapping Korotkov sounds. The gauge reading at this point is the systolic pressure. Continue to slowly deflate the cuff. When the Korotkov sounds disappear, note the gauge reading. This is the diastolic pressure. 6. Recording the measurement. Record the systolic and diastolic pressures as a fraction, e.g. 120 or 80 mmHg. Note any irregularities or special conditions during the measurement. Meaning of systolic and diastolic pressure. Systolic pressure, the pressure in the arteries when the heart beats, contracts, and pushes blood through the body. It is the higher number in a blood pressure reading. Diastolic pressure, the pressure in the arteries when the heart rests between beats. It is the lower number in a blood pressure reading. Normal blood pressure ranges for different age groups. Infants 0 to 12 months, systolic 70 to 100 mmHg, diastolic 50 to 65 mmHg. Toddlers 1 to 3 years, systolic 80 to 110 mmHg, diastolic 55 to 70 mmHg. Preschoolers 3 to 6 years, systolic 80 to 110 mmHg, diastolic 55 to 70 mmHg. School-aged children 6 to 12 years, systolic 85 to 20 mm, diastolic 55 to 80 mmHg. Adolescents 12-18 years, systolic 90 to 120 mmHg, diastolic 60 to 80 mmHg. Adults systolic 90 to 120 mmHg, diastolic 60 to 80 mmHg. These ranges can vary based on individual health conditions, lifestyle, and other factors. Consistently high or low blood pressure readings may indicate health issues that require medical attention.